All right, y'all, welcome back to Level the Playing Field. Now, in the past, y'all see me using this surgery simulator to do what I call surgeon free throws, which is just kind of keeping the skills sharp. So on the day of surgery, I'm ready to go take care of patients. So my man Tim, my producer here, is in the background, and while I'm shooting my free throws, he's gonna ask me a few true or false questions and see if I can keep my focus here. All right, let's get it.
Yes, sir. All right, so not necessarily true or false, but these should be, for lack of better words, free throws for you. All about what you do every day in orthopedics. So first one, just give us, what is orthopedics?
Yeah, so orthopedics is the medical specialty focused on the health of the bone and joints. So most times when someone says they're talking about orthopedics, they mean orthopedic surgery. And so, we are surgeons by training, but our focus is on the bones and joints. And we don't always do surgery. Most people actually don't need surgery, in which case we'll treat them different ways. So if you break a bone, sometimes that needs surgery, sometimes that needs a cast. Either way, that's orthopedics. If you tear a ligament, sometimes that needs rehab, sometimes that needs surgery. That's still orthopedics. So things related to your bones and your joints, that's the orthopedic medical specialty. Light work.
There you go. All right, what's the difference between an orthopedic surgeon and an orthopedic physician?
There actually is no difference, at least not in the American medical parlance. So when someone says they're an orthopedist, they inherently are saying I'm an orthopedic surgeon in America. Now, there are people who are non-surgeons who may be affiliated with orthopedics. An example is a sports medicine doctor who's not necessarily a surgeon, but takes care of athletes. Now, that person might take care of athletes who get hurt on the sideline, but they're not going to do surgery. If something needs to be treated surgically, they'll send you to an orthopedic surgeon. But if you say orthopedist in the American medical parlance, you're saying orthopedic surgery.
Fair enough. All right, what are the most common orthopedic surgeries?
There's a drop. The most common orthopedic surgery is a knee arthroscopy. So an arthroscopy is just like I'm doing right here, where I'm kind of using a camera to move around a joint and using tiny instruments to move around inside and do work. So a knee arthroscopy is usually done most commonly to treat a meniscus tear, a meniscus injury.
All right. How about let's get into some arthritis. How is that treated generally by orthopedic specialists?
So the number one treatment for arthritis is getting that joint moving again through low impact cardiovascular activity. So the most common place to get arthritis is your knee and hips. And frequently, when someone has some kind of low-grade arthritis, we try to help them work on strengthening the areas around those joints. So if it's your hip that has arthritis, you want to work on strengthening your gluteus muscles. If it's your knee, you want to work on strengthening your gluteus muscles once again, but also your quad muscles to help your joint to move. When we say low-impact cardiovascular, we're talking about things like cycling. We're talking about things like, walking, swimming, water aerobics are also great options. But that's the first line of treatment. We only treat surgically if someone has tried all that and it doesn't work.
All right, let's get into the recovery process. So let's say that I've had a knee arthroscopy. What does my recovery process look like after that?
So your number one thing after any knee surgery, arthroscopy included, is to try and get that joint moving appropriately. So usually you end up doing some kind of physical therapy after a arthroscopy or any orthopedic surgery. And the number one goal is to work on getting your joint moving again. After you've got that going, they then work on strengthening the muscles back around your knee, because any surgery or any injury first, and then surgery is going to affect your muscle strength. So we got to get that muscle strength working so you can start doing what you need to do again. After that, you start working on more specific activities to what you do on a daily basis. So for instance, if you are a football player, once you've gotten your range of motion and your strength back, we work on things like football drills to gradually get you there. If you are a dancer, then we gradually work on getting you doing the dance movements in a safe way. So that's what the pathway looks like really for any orthopedic surgery, and that includes a knee arthroscopy. Oh, you got me twisted, bro.
All right, let's say I have a scheduled knee surgery coming up. What am I expecting on day of surgery?
Yeah, so day of surgery is something you really got to talk to your physician about in detail. But things to consider, so In most cases, you're undergoing some kind of anesthesia for a knee surgery. So you want to kind of discuss what kind of anesthesia plan you're going to have, because there are different ways that can go. On the day of surgery, you're going to meet with the anesthesiologist in more detail and, of course, discuss the plan. You're also going to talk about the plan with your surgeon themselves. So the surgeon should have talked to you already about, most aspects of the plan, but it's let me fix my thing here. There we go. It's important on that day of surgery to make sure all your questions are answered about what the plan is for surgery, and then what to expect after surgery. In a lot of cases, you'll have loved ones who are going to help you. So that's a very important time for you to come prepared with all your questions. And that's your chance to ask before things get done. That day of surgery, you'll usually sign some kind of paperwork agreeing to go forward with the surgery. So of course, that's your chance to either agree to go forward or to say, hey, I'm not doing this. And it's perfectly okay to say on the same day, I'm not doing this. I've had people do that. And if that's what I'd much rather you make that decision before we did surgery, having reviewed everything we talked about, and make an informed decision not to proceed if it's the safest thing for you. Now, some surgeries are, emergencies, in which case maybe it's not the best thing to just kind of pull out of it. But a lot of orthopedic surgeries are not emergencies, and more about how you feel about it. So if you say, hey man, I don't know if I need all this, and I feel like I can get through life the way I am, that's okay too.
There you go. Are there any new advancements in orthopedic medicine that you're excited about?
Yeah, so we're getting better and better at treating cartilage injuries. So remember that cartilage is that smooth surface bearing inside your joint? When that cartilage gets kind of all the way worn away, that's when we talk about things like arthritis, right? And so, right now, if you get bone-on-bone arthritis, the surgical treatment is to replace that joint. Now, there's some people who are all kinds of in between who maybe have some arthritis, but all their cartilage isn't gone. And so we're trying to improve our treatment for that. And so we've come up with all kinds of different ways to treat patients in those settings, which can include things that can even help, try to restore your native cartilage if you have just a pothole that's missing. Or we can do things that kind of create more of a barrier in between the joint to replace what that cartilage was supposed to be doing but isn't anymore. I would say that's one of the biggest parts growing of orthopedics, is how we can use different techniques to help people who don't have necessarily bone-on-bone arthritis but have some cartilage injury or missing.
Cool. Okay, as a common person, let's just say my knee hurts. We do this thing where we assume the worst a lot. But when is there like a sign that people can look out for to know, like, oh, this is real, I need to go see an orthopedic doctor?
Oh, that's a good one. So yes, most knee injuries, or let's say most knee complaints, don't need to see an orthopedic surgeon right away. A lot of times people hurt their knee or they injure their knee, it's really just a sprain or what have you, right? And although it might take longer than you want for it to go away, it's not necessarily an emergency. You got to run to an orthopedist. Now, that being said, some signs to consider, and you should always consult with a medical profession if you're having an issue, or medical professional rather. Things to consider to be seen more urgently is my knee, largely swollen, right? And the swelling not going away with conventional kind of treatment. So conventional treatment being like elevation, ice, rest. Or is my knee locking? Is it getting stuck in place so I can't move it? That's the reason to believe something more might be going on inside that knee joint than just a sprain. And that's a good, excellent reason to be seen right away. Certainly, if you had a big acute trauma, then yeah, you want to be seen right away. So your car accident, now my knee won't move and it's swollen, be seen right away. Sports injury, my knee won't move, yeah, go see right away. I worked out a little bit too hard and my knee is stiff and sore. Sometimes you can give that a chance to get better, but as always, if you're concerned, always consult with a medical profession. We're never going to turn you away. It's just more about deciding if it needs to be seen right away or not.
There you go. That's pretty much all I got, man. I mean, I think we covered a lot of the list.
I only had one drop, I think, the whole time, huh?
Yeah, doing good, man.
You did pretty good. All right, so if y'all think you can hang with me out here, man, I want to see you get on here and try this too. So let me know down in the comments below if you want to come on level the playing field and work on some of your arthroscopy skills and see what y'all got. And some of y'all need to be out here doing surgery and helping people using those skills you learned playing video games to help the world. All right, so until next time, this has been Level the Playing Field. Y'all take care. Y'all didn't see that.